to be able to come to that. So we should not be under any illusion that, okay, once I get to that 5 WHO standard, then we are in a world that nothing will happen to our health. Because health is actually a very complicated issue. It is not just exposure, and that is what we talk about these days. It is not just a linear, one exposure, one health outcome again. There are many other factors. Once you eliminate, okay, look for us in Africa now. We talk about the cooking, the indoor air pollution. They change stove for people. But after that intervention of giving people new stove, you expect that even when the number of the levels of the pollutants, maybe PM is low, you expect that there will be a significant health improvement. But it doesn't always work like that. Because the person that, even though is not cooking with this, you've improved whatever they're using to cook, they might have other lifestyle that impacts their health. And sometimes the pollution they are exposed to is not just the pollution from indoor. The total exposure, not what was measured. So when you're looking at health impact of air pollution, it's more complex than many people believe. And that is what all the public health related associations are saying. That was their argument they put forward. So that people don't say that once the 5 is good, there is no, from the pool studies that have been done now, you cannot say even the 5 for PM 2.5 that there are negative health impact. So understand it is in relation to negative health impacts.
Negative impact. What case studies have you come across that the negative impact of that 5 had had? Because we are looking, as atmospheric and air pollution scientists, we are looking at what the WHO is talking about and what have been published in recent journals. So what are your suggestions?
It is not, we based, I think many of us don't realize that the WHO standard doesn't just come, the guideline doesn't come from the moon. It is based on pool studies that were pulled. For the all the studies that guideline was based on till today. Even with that 5, you cannot say there will be negative health impacts. But what people are saying is that start from there. And that was what the key message I pointed out, that even in areas where you felt that there are low concentration, take for instance, for me coming from Nigeria, when I have people like in Germany getting annoyed that they still have traffic pollution, I laughed because most of our home cars, the cars that they have spent for 10 years, they have used in Germany, when it still come to Nigeria, we call it brand new Tokumbo. So that Tokumbo means it came from overseas. We call it, Tokumbo is a local language. Call it. So if you are able to buy a car, to even be able to buy a used car in Germany that is about 10 years, is a lot of money. Nobody will be able. So we call it brand new Tokumbo. You call your friend, you buy drinks for your friends to celebrate it. So when I have the people from Germany now even getting annoyed that about air pollution, so I was like, so we have a lot of milestone to go. But please don't be intimidated by that. What that message is saying is that air pollution is a serious public health issue. So that is what that message is just telling us. So even if people that we look at as good, as struggling, that means for us here, we are really living in hell. I was shocked, when each time we talk about people burning waste, we think it is only the poor people. I kept reflecting on it, that we were in a class, we are doing air quality workshop. Then we have, within the same university, this is one of the prime area. We can smell the university burning their waste. And if you look into that waste, there will be plastic part of it. So some of these things are our reality. And what the message is simply telling the whole world is that, look, we have a serious public health issue in our hand, and we should not handle it with levity.
Thank you very much. I think mine will be like a contribution. Air pollutants are harmful substances. Even if it is only one molecule, it will create harm. That is why Madam is saying there is no safe concentration level, even if it's only one molecule. But because we have a big problem, we need to start somewhere so we can go gradually. If we tell everyone reduce it to 0, it may not be easy. But the safe standard is to have 0 air pollution level. That's the safe standard. Because every molecule will create harm. 2 molecules will create more harm. 5 molecules will create much more harm. So that is about that. I want to say, maybe to add again, that in our country, maybe in some other West African countries, the issue of air pollution control or regulation is made complex by the fact that, coordinated activities or monitoring. For instance, I have a research group. We acquire some monitors. We have our data personal to us. Another group has its own research activities on air pollution. They have their own monitors. So there is no centralized, coordinating activity to put all these monitors together. And that is what I think we should advise government to do, to adopt, since they cannot acquire all these monitors. Various efforts are being made various places. Government should take the initiative to adopt these different research activities and instruments so that we can have centralized database and make that data available so that researches can go on. In that way, government will be able to see they are not directly involved. It will be easy for them to, enact laws that can help in air pollution issues. Thank you.
Thank you. My question is to the Gambian Environmental Protection Agency. From the Ghana perspective, we're talking about environmental impact assessment and maybe undertaking, bringing in reports, monitoring reports. So I'd like to know from the Gambian Environmental Protection Agency that if you have a big project in Gambia, any undertaking, either be mining, either be a big industry, how do you go about regulating those industries and how do you permit them?
Okay, thank you for the question. In the Gambia, we have issues with environmental impact assessment because in my office, we have a whole program that looks into environmental impact assessment. But like I've just reiterated during my deliberation, we have challenges when it comes to monitoring those sites. Most of the time, most of the times, the monitorings are done visually. There are no equipments to say these are the scientific data we are bringing back to the table on arguments. Or what we will do is to get to the network, to the internet, and see relative situations like that. But because, especially when it comes to air quality as an impact of what is happening in most of our areas, we have a challenge. We have some mining activities happening, but even with those ones, when it comes to air quality, there are no actual monitorings happening because we do not have the monitoring equipment to know what is exactly happening at those various sites.
So it's great to see the 5 different countries on the stage. I was wondering if any of you would like to comment on regional air pollution. I know the Hamas affects all 5 of you, but in terms of more anthropogenic pollution, is there any strategies where working between the 5 countries would appreciate? Okay, so it's great to see the 5 countries on stage. And so a lot of air pollution is local, but also a lot of air pollution is regional. And so with the 5 countries sat next to each other, I was wondering, is there any joint bilateral or more than bilateral, multilateral discussions on regional air pollution and how that affects your great cities?
Okay, so the politics of West Africa, some of the West African countries are Francophone, some are Anglophone. So an outsider, you might not know that even within West Africa, we have our own issues. For a long time, we wouldn't even work together from one country to the other. And I keep telling, I went to Imperial College in the UK, London, Imperial College London. And one of the things I learned, that was several years ago, is that when UK was part of the EU, many of the research team, they are always working together in different countries. So when you see a lot of them, they publish a lot of papers, they work together, they're able to attract good funding and what have you. But in terms of West Africa, we've had different political issues. We have military intervention in some countries. So it has, and diplomacy has broken down in some countries. We penalize each other with not even giving each other access to come in. I was discussing with some of my colleagues from Nigeria that you cannot even come to Ghana from Lagos by road. The roads are very terrible. And then when you get to Aflaho, they will, even when you get there, that is before you now enter, they will ask you, no matter who you are, you will park. Even though we carry ECOWAS passport, all of us are supposed to move freely within ECOWAS. Then they begin to, as if you are going to take a visa again. They are not going to give you, you're not going to apply for a visa or what have you. So I think the political setup in West Africa and different changes in government we've had. Now we are having a lot of more stable democracy. Like in Nigeria, we've had democratic government for some time, in some countries too. As the past political structure we had not been very helpful. So it's very difficult for even researchers to communicate. In some countries, they cannot even issue some of their data out to each other. And then the internal wrangling and what have you. But what the younger generations are trying to do, my generation and doing with other people, is one-on-one trying to, in fact, the first day after I came in here, I told Dr. Hughes that we need to work together. So people on personal contact tend to work together. I'm working with people in Ethiopia now. I'm trying to, but our institution, if you still have the conservative ones in power, they will restrict it. I was joking with some of my colleagues, if you are on the internet, the young people, they always challenge Nigerian jollof is better than Ghanaian jollof. Ghanaian jollof is better than this. But when I heard this Ghanaian jollof, I don't see any difference in this thing, for God, crying out loud. I'm asking myself, in fact, I was asking the Ghanaian, is it not basmati you are using? You use basmati for this. Is it only basmati? There are some places also, apart from the Polish, we use basmati. So I think we are just, we've not really had institutional support to bring about integration. And unfortunately, our ECOWAS region, and because of the colonial interference, the Francophone, even when sometimes they come up with this, somebody will say, France said this, they will pull out at the last meeting. Ordinarily using regional currency, we are not able to go get it.